We started doing DaVinci surgery over a year ago, and it's so much different than the traditional approach where we used to make a long incision. The patient would stay in the hospital 3 to 4 days, out of work 8 to 10 weeks, a lot of post-op pain. With the DaVinci system, they go home the next day typically, are back to work in 2 to 4 weeks, a lot less post-op pain. Instead of a long incision that we used to do, the incisions are about this long. There's 4 of them. Patients require less post-op pain medication, and we've been doing these for about over a year now, and we've not really opened a patient for over a year. I mean, it's just such a different operation for the patient. It's that's the most gratifying part. It's totally different for the patient. When we first started doing them, we would call the patient the next day after surgery. I called one patient, and her mother answered the phone, and I said, "Is Lynn there?" And she said, "No, she's out walking the dog." So it's just a different it's a different procedure. It's, you know, in my 35 years of practice, I think the technology is the biggest improvement I've seen in the care of women in the last 35 years. And we do other things with it. We remove smooth muscle tumors for fibroids or women who are trying to get pregnant and can't. We do endometriosis surgery with it in patients who are trying to get pregnant or we're trying to control their pain. It's amazing, when we used to do endometriosis surgery, we would do this through a standard laparoscope. And when we do it with the robot, we can see 25% more of the disease that we were missing before because of the high definition camera and the 15 power magnification.